Distinguished guests, progress towards malaria elimination has stalled since 2017, and the latest World Malaria Report has sounded an alarm about the possibility of reversal of the progress made since 2000 and failure for the world to reach the WHO Global Technical Strategy targets. Africa continues to be disproportionately burdened by the disease, and according to WHO estimates, 96% of global malaria cases and 98% of malaria deaths occur on this continent. In 2020, 611,802 people died in Africa from this disease, of which 80% were children under the age of 5. Furthermore, revised estimates by WHO in the 2021 World Malaria Report indicate that the number of malaria deaths was previously underestimated, and the burden is actually worse than previously understood. Drastic action and a business unusual approach is needed to course correct and sustain progress towards malaria elimination in Africa and eventual eradication globally. We need new affordable tools and scalable technologies to deploy and monitor the performance of interventions and the performance of malaria programs from the local to the national to the regional and to continental levels. The COVID-19 pandemic is further exacerbating the situation. The pandemic continues to put incredible strain on our health systems and economies across the continent. According to WHO, COVID-19 caused an estimated 47,000 additional deaths from malaria in Africa in 2020. Although this was significantly less than the worst-case scenario, which predicted that malaria deaths could have doubled, the situation is still dire. Most countries in Africa did not achieve the goal of reducing malaria incidence and mortality by 40% by 2020, a key milestone to eliminating malaria in Africa by 2030. There is renewed political commitment to mobilize domestic resources, leverage on technology for digitalization for evidence, informed policy and programmatic actions, putting youth at the center, and increased intergovernmental coordination through regional economic communities, working more with partners at national and international level. One of the most successful uses of technology to support the malaria response across Africa, and indeed to support the wider health system, has been the deployment of the DHIS in countries across the continent. DHIS2 revolutionized digitalization of health data in Africa and has greatly enabled availability of data, particularly within the health sector. As service delivery in many countries is extending from health facilities to the community level through community health workers, country district health information systems are also capturing and digitalizing community health data. This has been a remarkable starting point for digital programs, but much more is needed for effective digitalization of data to support the malaria elimination agenda. There are other existing efforts to integrate digital technology in malaria programming. In recognition of the need for digitalization of data, and as part of his bold and ambitious 4-point agenda, His Excellency President Uhuru Kenyatta, the President of the Republic of Kenya and Chair of ALMA, took a bold step to have a digital platform developed for countries to share data and best practices. To date, 14 countries are sharing data on the platform, whilst also participating in online courses. ALMA has supported 40 malaria endemic countries to develop and implement country-led malaria control and elimination scorecard management tools to strengthen accountability and action. I urge all these countries to join this platform. These digital tools utilize existing data, predominantly from the country health district health management information systems, to track the performance of prioritized indicators which are selected to reflect overall performance of a country's malaria response. The scorecard tool can track indicator performance at multiple levels, across regions and districts, over time, and automatically displays performance in a concise format using easy to understand traffic light colors to simplify interpretation of performance. Scorecards are widely accessible, and in addition to being used by malaria programs to inform routine programmatic decision making, in several countries they are used to advocate to political leaders to share in multi-stakeholder forums and platforms, and to update and mobilize communities and civil society and the private sector to support improved malaria response. These scorecards have greatly contributed to data-driven decision-making and have enabled diverse stakeholder contributions to malaria programs. Through the identification of underperforming geographical areas, they promote equitable distribution of services, and by identifying poorly performing indicators and areas within the health sector, they enable targeting of resources to where they are most needed to make a difference. The successful use of scorecards at country level has stimulated interest in their use at the regional level, and currently ALMA is supporting the implementation of regional scorecards in Southern Africa, in Eastern Africa, West Africa, and in Central Africa. Successful country use has also led to the development of a scorecard hub, which hosts country scorecards and publishes best practices on an open access website. Funding from global partners has enabled the scorecards and the hub to provide free of charge to countries a service that enables them to enhance the effectiveness of their programming and the participation of multiple stakeholders. The World Health Organization has also supported countries to develop national malaria repositories, warehouses, which collate routine and non-routine malaria-related data and provide malaria programs with information centrally to facilitate decision-making. These data repositories have been used to help assess different categories, which has enabled better visualization of the diverse impact of malaria within countries and identification of the most impactful interventions for different areas. Digital tools are also increasingly used for mass mosquito net campaigns to improve efficiency and quality across the planning, distribution, and reporting phases of the campaigns. Data collected during mass, long-lasting insecticide-treated nets campaigns has been further used to support other campaigns, such as for the seasonal malaria chemoprophylaxis, neglected tropical diseases, mass drug administration, immunization, and other interventions. Data collected through community health workers are also being digitalized, linking to the district health information system. In addition to promoting wide-scale use of these emerging tools, we need more scalable digital tools to strengthen malaria surveillance. The COVID-19 pandemic illustrated the usefulness of technology to guide disease response. Technology development and rollout enabled close tracking of the pandemic from local to global level, which was and remains critical to controlling the pandemic. Similar deployment of such tools for malaria will enable visibility of the problem and stimulate the multidimensional, multi-sectoral action required to fast-track progress towards elimination. With the emergence of resistance to current tools, such as insecticides that are used for LLINs and indoor residual spraying, as well as ACTs and parasite mutations which evade detection of common RDTs, we need technology to continuously monitor the effectiveness of tools such as extension of artificial intelligence in malaria surveillance, but also technologies to augment our prevention and case management options. Climate change is contributing to the current challenges in malaria control. Routine use of technology by malaria programs to better understand the relationship between climate factors and malaria transmission and to predict and mitigate climate change impact on malaria is going to become increasingly necessary. We need the global community to work together to make existing technologies available for use at scale and to support countries to build capacity for their use. For example, drone technology has been found to be useful in several relevant areas for malaria control, such as in identification of potential vector breeding sites, deployment of interventions such as medicines and other commodities. However, this technology remains too costly and too specialized for wide-scale deployment across the continent. The rapid development of technology globally and the increased incidence of global health challenges make the collaboration between the health sector and the technology industry timely. And the precarious state of the fight against malaria, particularly on our continent, makes this need critical so that technology can be adapted to the needs of communities they serve, as well as the evolving nature and trajectory of malaria. Collaboration will be crucial for sustaining the technologies as well as increased financing and expanded access alongside increased demand. National government must support the sustainable financing and mainstreaming of these technologies within their health systems strengthening efforts. And with support from the private sector and from the international community, funding must be made available to boost innovation, which is key to malaria control and elimination. Friends, distinguished guests, ladies and gentlemen, zero malaria starts with me. Zero malaria starts with you. Zero malaria starts with all of us. Thank you.